Welcome back. Welcome back. We just had an excellent presentation on hospitality, and now we're going to dive into a completely different industry, healthcare. So, Dr. Giles will be giving us a presentation on AI in healthcare, the good, the bad, and the possible. And with that, I'm going to hand over the mic to you and share your presentation.
Wonderful. Thank you for having me here. Thank you for the whole team at Swarm. It's a real pleasure to be a part of such a great conference. So yeah, let's get straight to it then. So when people think about AI in healthcare, they probably have all kinds of ideas that come to mind. Here's an image invoking Tony Stark, Iron Man, when he's interfacing with Jarvis and his computer tools, or even what's his name? The character Tom Cruise played in Minority Report, the precogs and trying to see into the future and all this sorts of stuff. And when you ask AI, what does AI in healthcare look like? It comes up with this sort of psychedelic image. The reality is that most clinicians are not really using AI in their day-to-day basis. They are using telemedicine. That's quite increasingly the case. It's not particularly new technology, being able to speak to someone over the phone or with a video call, but to do so in order to administer healthcare isn't that revolutionary. Computers have been around for a while. This is a photo from allegedly 1987, but in different parts of the world, different hospitals, this could even have been just yesterday. Now, of course, clinicians are not always smiling when they're using computers, especially when using AI. And that can even be based on the use of AI by patients. We'll touch upon that a little bit, not so much the maybe perhaps obvious part of Dr. Google, patients using various AI functionality to diagnose themselves. Past that, it's more so the fact that a lot of the dialogue is really about clinicians. And as part of this talk, I'll be highlighting that we can't just do that. There are also other people involved. But anyway, let's first go on to the good. What is the good that's going on here so far? Well, for one, we've got enhanced diagnostics and prediction. This is a good opportunity for AI in healthcare. So PathAI has developed AI-based pathology tools that assist in diagnosing cancer from tissue samples, helping improve both speed and accuracy. Really good. Precision medicine. This is specifically when you are being very targeted with medical treatment options. And Tempus here, they use AI to analyze clinical and molecular data, providing cancer patients with personalized treatment options, supporting data-driven oncology decisions. Okay, that's cool as well, I suppose. Operational efficiency. So how are we getting clinicians to work more efficiently, more effectively? And so we have Qventus, which has got the solutions that uses predictive modeling using AI to support with hospital operations, optimizing patient flow, reducing emergency department bottlenecks to improve resource allocation. So at certain times of the day, certain times of the week, times of the year, patients are more likely to go to the emergency department. So traditionally, if it's Christmas, Thanksgiving, Super Bowl, some other great sporting event going on, people are actually less likely to go to the emergency department. So like the finals of America's Got Talent or something like that, people are actually going to instead watch that, then go to hospital with their arm hanging off because they've been in a road traffic accident. Let's move on then. So we have augmented clinician or clinical decision making. So how are we enhancing or improving the way that clinical decision making is actually done? And so Viz AI analyzes CT images for signs of large vessel occlusion. So this is blockages in big blood vessels is another way of phrasing it, specifically in people who've had a stroke. And this can alert neurosurgeons in real time to help prevent delays in treatment. So in real time, you can see what's going on with the stroke of a patient. The next one then is looking at Viz AI. This is got a slight typo there, apologies. So this is actually more so looking at how is AI being successfully used to support with how people get their healthcare seen to 24 hours a day. So continuous monitoring basically is what we're getting at here, and continuous access to healthcare support in some way, shape, and form. And then here we've got medical research and drug discovery from Benevolent. So it's basically using AIs to help speed up the discovery of the drugs. What works, what's going to fail, what binding site are we going to need to this protein, this structure within the body that's causing pathology? What does that structure look like? And what structure does the drug that we need to look like? And AI doing that computational analysis to discover that. So really great work. Really, really great work. But there is bad things. Some of this is kind of obvious. Some of it's stuff that people are already aware of. So let's get the first one out of the way, and that's racial bias. We already know that AI can be a little bit racist. And the fundamental reason for this is the fact that it is relying on data which can be racially biased. It can be biased for all kinds of reasons. And we know that data quality in general is a big problem in data science, let alone AI specifically. The better the data you have, the more useful the data can be, the more you can do with it, the more objectives that you'll be able to achieve with it. And specifically here, there was a study, some research done, in 2019, which proved that actually their assessment of when to pay out and when to provide services to Black populations in the US, if there is more of an emphasis on how we best going to support these people because of money rather than their actual health outcomes, the actual needs that they have for healthcare, we could probably provide poorer healthcare for Black people. And that's literally what's been going on in the US. There's a variety of reasons for this, not just when AI has been going on, racist ideas and racist beliefs of how pathology exists in Black people versus any other type of population. But for sure, racial bias is something that has caused problems. And Optum Health comes to mind with this, and it's quite unfortunate. But when you recognize there's this problem, it makes it easier to find a solution to it. So next then is over-reliance and de-skilling when it comes to dealing with computers. So I think there's been a healthy skepticism about IBM Watson over the years, primarily because of there being a lot of talk about the issues and the failings that IBM Watson has had. But in particular, it's been known to be unsafe and incorrect in identifying cancer treatments or providing cancer treatments. And this is quite scary. If you are fully trusting of an AI system to get things right, believing for it to be completely infallible, then when it gets things wrong, that can lead to devastating consequences. Next then is regulatory and ethical challenges. So here is specifically looking at Pear Therapeutics as an example. If you're not already familiar, Pear Therapeutics was a pioneer in digital therapeutics. And when it went bankrupt, it's really left a serious bruise, a wound, in fact, in investment in healthcare, investment in digital health, investment in digital therapeutics, because actually Pear Therapeutics has created really great products to help with people that are dealing with different types of addictions. And ultimately, though, they didn't know how to best adhere to regulatory and ethical needs. So for sure, they had a product that was approved by the FDA. However, it wasn't really aware of how best to make sure it can get reimbursed. And even for people to justify paying them to use their service versus standard treatment. And this leads on to the final bad area I want to touch upon, which is expectation inflation. So Forward, they primarily worked in primary care, so community care, stuff before you go to secondary care, so before you get to hospitals and the like. And they came up with the idea of care pods. So you go into a pod, AI will be working with you and taking blood tests and various measurements to then assess your health and give you treatment. And there was just a lot of hype basically around what Forward could do with its care pods, and in general what AI can do in healthcare. It doesn't mean that AI can't do great things. Of course it can. We know it has. We've just mentioned it earlier on. But this expectation that it will solve so many problems, and in particular the problem of, oh, we need to make money. If we're paying loads of money to doctors, how about we get these providers to pay us instead to provide these healthcare services, or pay us specifically to pay us instead of paying the doctors to provide these healthcare services? It's a fallacy. It's almost lunacy to just be fixated on the doctors and how we can replace them with technology, particularly AI, to make things better. And we need to be more grounded in reality. So this leads on to the possible then. I think it's really important to get to the crux, the root of why I think a lot of these problems are existing with AI in healthcare, but also why it has so much potential as a technology. AI is always a tool, but not always a solution. And it's very easy for us to be fixated on the fact that AI can solve problems, but it is a means to an end rather than an end in itself. It is something we utilize to solve problems. And just like any other emerging technology, like virtual reality here, or specifically mixed reality, because this student is using a VR headset and also interacting with these devices in order to simulate surgery here, some orthopedic surgery here. And it's really important that we recognize that as much as there's great potential, it's still a tool. It's still completely dependent on how it is used in order for success or failure to be achieved downstream. A big part of this as well is recognizing that because it's a tool, and specifically a technology that deals with computer science, actually human-computer interaction needs to be considered a lot more. There's a blog article I was reading in preparation for this talk from JR Panel Community, and it has a really nice definition of human-computer interaction. My master's degree was in human-computer interaction with ergonomics. I had ergonomics at the end just to emphasize that that's a really important topic. But as you can see here from the graphic on the right, there's actually loads of things that come to mind and are pertinent to HCI. And as the definition here says, HCI is the intersection of computer science, human factors, exploring how to make computers better serve humans. Because computers are tools at the end of the day. It focuses on how computers can be designed to better suit human needs, and how user experience and efficiency can be improved by designing better interfaces and interactions. And it's really, really important that we keep in mind that AI is part of this computer that we are interacting with when we talk about human-computer interaction. It's not the human. The human is a whole other part of it. And what's interesting is when you look at human-computer interaction, actually the vast majority of it is trying to understand people and how that then leads to the thinking that goes on and the interactions with technology. Ergonomics and human factors, as just quick definitions here. Ergonomics is talking about what is it about the environment that we're in that can lead to risk of harm or even death, or at least error. And human factors is what is it about the human that could lead to harm or error when interacting with the world around them. So that's why they tend to go together, ergonomics and human factors. I think a lot of the other terms may already be known to you, but it's just emphasizing that a lot of it is not just about understanding how people think and behave, but what is it about how they think and behave and the environments that they exist in that can lead to harm, lead to something bad happening. And in healthcare, this is paramount. It's probably one of the biggest parts of my job as a clinical UX strategist is how am I ensuring that when a human, be it a clinician or a patient, is interacting with technology of any kind, or even just interacting with healthcare, how are we making sure that there isn't risk to harm, errors, people dying? So if we look at what AI can really help out with, there's so many opportunities. We already highlighted some of them earlier on in this talk. But a big area, and I've spoken about this for quite a few years now, is digital therapeutics. And really, digital therapeutics are the future of healthcare. Just as a quick definition, a digital therapeutic is any evidence-based digital technology that can prevent, manage, or treat disease. So there has to be evidence that backs up that it works. Otherwise, it could just be any concoction that you've given to someone, digital concoction you've given to someone to keep them healthy. And then it can either prevent disease because it's assessing for it and then guiding people towards next steps. It's actually managing chronic disease when there's actually a diagnosis, or providing curative treatment to it. Whatever it is, if it's a digital solution that's doing this, sometimes in conjunction with a wearable device of some kind, that's a digital therapeutic. These things are regulated and they are very sophisticated. And when they work, they can have profound impact. But it's not as simple as creating a great digital therapeutic, as Pear Therapeutics' demise has proven. Now, the reason why I highlight about digital therapeutics is that there's many, many benefits to its use. And if you're curious, feel free to check out a video I posted a few years ago with Nemensa, which talks about digital therapeutics, and also a white paper I wrote recently with the agency Whitespace. It goes into loads more detail. But the main things I want to highlight is patient empowerment and clinician enhancement. So what do I mean by patient empowerment? Here, I'm talking about the fact that patients are helped in taking more control over their health and have better health outcomes when doing so. This should start off with building trust and hope that they can be healthier. It's very easy for patients because they're on a spectrum. We've talked about cognitive science, ergonomics, human factors. What is it about the life that someone has lived, the experiences that they've had, the experiences their peers have had, relatives have had, that leads them to lack trust and lack hope in healthcare and their health outcomes, respectively? That they don't trust clinicians, that they don't believe that they will get better. When you can empower patients to have more trust in the healthcare system and more hope that they can get better, everything downstream as behaviors becomes so much easier. Having continuous monitoring and assessment is a great opportunity for AI, though, specifically. It provides an opportunity for AI to look at data that's being collected from wearable devices or even very simple health questionnaires that the patient fills in to assess where's the patient going with their health, what's their current health status, and comparing that to what was the previous readings, and also comparing those readings to a variety of diagnoses or even the results of similar patients. There's personalized care plans. So it's not just the patient with this disease and this specific symptoms and signs should have this treatment. It's like, actually, this patient with a holistic understanding of who they are needs this type of treatment, and this being tailored by AI, reading all of the treatment plans that's available and what's best for this patient. And in presenting this information in a way that's easy to be digested by the patient themselves. So tailored data visualization rather than generic graphs and charts that non-clinicians simply aren't going to understand. Then there's smart goal setting. So it's having goals that are realistic about health, realistic about what can and can't be done by this individual person. Someone who's in a wheelchair can still be active with exercise. What that looks like for them is going to be very different if they are hemiplegic and they can't use their legs at all, or they just have some strains and aches and pains, which means they have to be in a wheelchair most of the time. And also someone who doesn't necessarily complain of any leg problems, but perhaps they are obese. So thinking about exercise and the goal of what exercise looks like is a very personal thing. So having smart goals that are continuously assessed by AI to see, well, is this actually realistic? Is this working out? Can be done with the patient without the clinician even being involved. And in making healthcare more accessible, being able to go to your phone to look at what's been going on with continuous assessment, what's been going on with a care plan being adjusted based on the results of that continuous monitoring and assessment. And looking at all the evidence, if you want to look deeper into the data, to understand why the recommendations for next steps, recommendations for goals are being made. Then there's clinician enhancement now. So this is supporting clinicians to work more efficiently with more time for patient contact. So again, we need to begin with trust and hope. Clinicians are used to having terrible technology to work with. Furthermore, they need to have hope that using this technology is actually going to make a difference. Otherwise, why use it? Again, because there's been so many technologies that have come and gone. Now, one key area is decision support. So this is where technology supports the decision-making of a clinician. A very easy opportunity for this is you've got a patient with a specific diagnosis. This has been inputted into the system so the AI can read this. There's standard treatment plan for this, but you as a clinician who's only seen this patient for the first time and maybe even a bit junior don't know what's the best drug to prescribe. Furthermore, you don't know if a particular drug is more or less likely to work in this patient because of allergy status, past treatment, so on and so forth. So the AI can be reading all this data, looking at the most recent publications as well, and saying, well, actually, the data from this hospital on the guidance on what to do with this patient is a bit outdated because something just got released showing new evidence yesterday. This is where AI can be really powerful with decision support. Then there's triage. Actually, when we look at the other end of the spectrum, where the patient has filled in these health questionnaires, been involved with this continuous monitoring and assessment, the clinician can then see which of these patients who have gone through this process of continuous assessment actually needs to be seen by them. So like you go to the emergency department, there'll be a senior nurse that checks you over to see, are you for major trauma, or is this a minor thing that a more junior clinician can deal with? Then just deciding where you get put in the emergency department. This can be done digitally without even the use of humans beyond the patient or some other carer, loved one with them. Then there's patient reassurance. I'm sure we've all had stories personally or those of loved ones, friends, who have gone to an outpatient's appointment just to be told that everything's fine. You don't need to do that. You could have a very personal conversation, but this could be driven through an AI chatbot or other interface with a computer system to reveal that everything's fine. And then again, tailored data visualization, actually communicating to the clinicians exactly why you should be worried about a particular patient. Where's the evidence to back up some of the decision support information and recommendations that's being provided? And then remote working. So I don't mean as simply as me, for example, being able to be on the patio here in Florida and then still be able to see patients. It's more so that flexibility of you being able to even work with patients who are in another part of the world, like literally another continent, let alone country, and being able to provide the expertise where that is lacking. So we need to keep in mind that AI is a tool, and that tools are used by people and all kinds of different types of people. And by keeping in mind that these different types of people have different needs, different contexts, which means that AI being utilized for their health is going to probably look a little bit different. And users of computers are really getting younger. We should probably keep that in mind as well. Thanks for listening. Please stay in touch. And hopefully we've got time for a few questions.
Man, Dr. Gyles, that was fabulous.
Thank you.
Let me, okay. Yeah, I mean, that was an excellent treatise into everything that's been going on as of recently and in the future of AI developments.
Mm-hmm.
I had something that I was going to ask you. Yeah, where do you see yourself being involved in the development of these newer technologies?
Mm-hmm.
You have coined the term UX clinical UX, right?
Yes. So the definition really gives rise to where my role would be. So clinical UX is still UX, and it's still UX in healthcare, But instead of just looking at how people in general interact with healthcare, I'm specifically focusing on the experiences that clinicians and patients have with healthcare technology and services. So of course, there's all kinds of other people, as even explained at the end of my talk, that's going to be involved with healthcare, but clinicians and patients are the crux of it, really. There are layers of management and law and legal folk and finance people and the like, but really, what are the clinicians doing in their workflows? How are we making that easier for them to focus on seeing patients and de-risking their work, less likely to make errors and more likely to get the right diagnosis as quickly as possible? And what are we doing for patients to actually engage with healthcare services? Because a lot of people are very distrusting of it. But also, how are we ensuring that people get the best health outcomes that they deserve? And having someone like myself, and there's a number of us, not a lot, but there's a number of us as clinicians who are getting into UX now, who are considering, well, there's loads of great work being done, but it's not keeping in mind context. It's not keeping in mind that, for example, it's wonderful idea to have apps for nurses on mobile phones, but nurses notoriously do not use a mobile phone in the ward. They might use a tablet, but it's a ward tablet. Doctors often use a mobile phone, their own mobile phone at work. Having an app for them could be useful, but who's paying for it? Is it the doctor? Is it the hospital? And it's like these realities of what's going on is what comes to mind. And then you throw in AI and it's like, are we supposed to be getting AI to make loads of decisions? Or are we supposed to help the clinician or even the patient themselves make better decisions? Because as again, I've mentioned, AI should be a means to an end. It's not an end in itself. It's a tool that should be utilized. And when we forget that there's humans involved, which can often happen when you don't have UX professionals working on these projects, especially UX professionals that really understand healthcare, it's easy for AI to suffer that whole view of it solving all problems when it really can't.
Yeah, I especially like that you take a broader approach in introducing human factors. Mm-hmm. And as you mentioned, it takes a village to be able to employ these things in production in the real world, because you said some company didn't meet regulatory compliance requirements, so they probably died because they were fined or they weren't able to operate and meet the revenue goals. There are other companies that are immature with their data practices, so they may be subject to fines. Violating data privacy laws, and there's just a host of concerns, and it requires all parts of the organization to come together and roll projects out, get feedback from the patients themselves to see if it is a viable solution.
That's it. Because it's not to say where we look at all of these issues or concerns that AI can't do great things. It's being realistic. It's being pragmatic. We want AI to succeed. We just have to use it properly and make sure we've got the right people involved to make sure that it's used properly.
When and how. So with all this being said, what do you think is the next step in your career, getting involved with all these projects?
Well, it depends if there's someone in the audience that's interested in working with me. But I think for me, it's definitely being more comfortable with not just using AI as part of my workflow, so supporting with research and design tasks, because there's a lot that AI can do to support UX professionals in their work, but also recognizing that AI is one of the many tools now and technologies that is part of the ecosystem of solutions we're giving to our end users, be them clinicians, patients, or any other type of person. So there's definitely lifelong learning that comes with this. I think that's the case with anybody who's either a clinician or working in technology. There's the field's always changing, but being open and excited as well about the possibilities of what AI can do to really make the lives of clinicians and patients better.
I often ask myself, and I ask my friend too, because he works in medical device sales, who is addressing the needs of the small, independently owned clinical practices? Because sometimes they fly under the radar of the medical representatives. They don't have any budget, or there's a ton of implementation requirements that they don't even know where to begin or have budget for. Anything that they can do, you think, to adopt some of these practices, or at least be more cognizant of how AI is reshaping the industry?
Yeah, I think it's there's two sides to it, really. Just like with any relationship, we can't just see it as the effort that these smaller organizations put into learning about AI. I think there is an onus on the technology companies as well, going to these smaller companies and trying to help them out. Google in some ways has done a good job of this in a more general way, not to any specific industry, but making so many technologies free, so many trainings available for free, so that people can play around and learn and see what's possible. But I think particularly in healthcare, it needs to be a lot more considered and tailored and personalized, similar to how healthcare in general should be delivered to people, is that we should be having reps from these different technology companies actually going to these healthcare providers and saying, look, here's how we can help you. This is what we can do for free. This is what we can do if you want to be in a business relationship with us as well. So it still sells to some extent, but it's also education. It's also trying to raise the quality of healthcare and technology in healthcare for everybody.
Dr. Gyles, it's been a pleasure.
Thank
and
you.
I hope to see you get some work in the fields of bias data remediation, or at least helping kind of break down some of those issues. There's so much to tackle, and I know you're the guy to be a catalyst in all these kinds of problems. So thank you very much.
And thank you. Speak soon.